Hi, everyone, and welcome to my YouTube channel and my podcast, depending on how you're listening. And today I am thrilled to welcome my friend and my colleague, Lisa Paladino. Let me just tell you a little bit about Lisa. First of all, Lisa is a certified nurse midwife, and she's a lactation consultant. And Lisa has a very unique and much needed approach to her practice, which I can't wait for her to tell you about. But Lisa and I were introduced by a mutual friend. I couldn't think exactly how many years back, but a few years back. She lives in Staten Island, New York, and she married to her husband, Russ. And that's a whole nother topic. We could talk about music if we want to go there, but they have a lovely family, and she's now a grandmother. So Lisa, introduce yourself. Tell us more about you.
Hi, Gina. And yes, thank you so much for having me here. There are few well, I don't want to say it like insulting anybody else, but it's wonderful to have a nurse practitioner friend who believes in the root cause effect, who we may be doing things that seem unrelated, but they actually are. And yeah, I don't know what year we met. It seems like maybe 2017, 16, like that, maybe. Like time is just flying, right? And now we're involved in a project together. And full disclosure, you're helping me with my health. And there have been times when I've helped you with yours. But
Right.
what do I do in my practice? So my practice is I like to say it's kind of schizophrenic. I have two different sides of it, or whatever, bipolar. I don't know what the best diagnosis would be. I take care of women who want a functional approach to healthcare. I've taken advanced courses in functional medicine and who want to look at why they're having health problems, such as hormonal disturbances, irregular periods, fertility concerns, thyroid concerns, PCOS, things like that. But on the other side, as a lactation consultant, I'm helping women who are hitting the wall. Like most of the patients that come to my office now or seek me out are those who have tried everything to help breastfeed. They've seen other people, they think they've gotten all the advice, and things aren't working for them. So a lot of the times that happens to be that I find tongue tie in babies, tongue tie and lip tie that's preventing nursing. So over the years, my practice has evolved to specialize in that. So that's where I get my tongue tie experts brand and platform. And I have a podcast and I'm on Instagram, bringing together the experts on tongue tie so that people can learn about it. So that's kind of what I do.
Yeah, absolutely. And I love it. And I also failed to mention that and you alluded to it, that we are in this project together called the Airway Revolution Foundation, started by Dr. Sydney Avis and the Avis family. And to bring awareness to the issue of airway-related disorders, sleep disorders, and for me, of course, the impact on cardiovascular disease. And so whenever back to the point of why is it that it's so important that you and I are together talking about these issues is because I see people in their 60s, 70s, 80s, even 90s that are high risk for heart attack, of course. And I keep trying to get more 30-year-olds and 20-year-olds. And I'm like, the earlier we can identify, as you said, the root causes, the contributors to cardiovascular disease, to diabetes, to dementia, the earlier we can intervene and course correct, and the next generation doesn't have to suffer from these chronic diseases the way
Yeah.
that.
Yeah. So ideally, if I'm doing my job right and I see enough people and there's more people doing what I do, less people will need you, right?
That's right. And that's what we want. Yeah, never did.
Yeah, exactly. So, including my own self, right? So, it's very easy to look back in hindsight and say, I wonder what happens. I wonder how I got this. I wonder how that happened. And this interesting thing happens in my office very often. I'll have a family come to me, and it's lovely because often it's the father and the mother, and they come together with the baby, and they're upset, and there's a lot of emotion going on, and they're a little nervous because nobody knows what a lactation consultant does, and they're always like, what is she going to do, And I put them at ease, and we start to talk, and I ask them questions about their own health history. If I notice a tongue tie in baby, or a baby already with an open mouth posture, signifying not breathing through their nose, which we all know we're supposed to, I'll say something like, do either of you snore? And then they start telling me about all the history of their own health journeys or of their other children. Like, no, I couldn't breastfeed my son, but now he's in high school and he's been through it all. He couldn't nurse. He had trouble with the bottle. He had trouble with solids. He's been in speech therapy all his life. Maybe he's got ADHD, and nobody ever checked for a tongue tie. Somebody mentioned that he might have one. Could that be related? And yes, of course it's related, right? Or I had a dad recently being treated by a functional medicine doctor for sleep apnea. And I was like, when I told them that their baby had a tongue tie, he was a little bit like, I feel bad. Did I do this to my baby? But the red lights went on for him, or the green light, saying, do you mean if we take care of him, we may prevent things in the future? And it's nice to make those associations. Do we know for sure that we can fix things and it'll be okay when they're older? Not necessarily, definitely. There's no guarantee, but it makes sense that it would, right? So we start out early, optimize all the function early, and hopefully it will all optimize as the human grows up, right?
Yes, yes. And it puts all the odds in your favor. We can certainly say that. Like, it's your best chance to not for these things.
Right. Yeah. So in that way, I think that everyone should know if they were breastfed. I think that there's a lot of reasons to know that. Not to, guilt anyone. Breastfeeding has come in and out of fashion. And when I first started my work around breastfeeding, which was a long time ago, let's just say that way, almost nobody was breastfeeding. And it's come back around in fashion. And so the generation that I was brought up in, and even my mom was brought up in, was not breastfeeding. They were not encouraged to breastfeed. So it's nobody's fault if you weren't breastfed. That's number one. And still, even as a lactation consultant, I respect every parent's choice to make a decision that works for them. However, I want them to make an informed decision. Fully informed decision, and understand how many benefits there actually are, or risks, when you do not breastfeed, right? So there's benefits to the microbiome, which are still being discovered, amazing benefits to the microbiome that no formula will ever replicate, no matter how much they try, because it's impossible, because a mother's breast milk is very unique to her individual baby. So there's that. There's, the bonding, yes. But the most important thing that I've been thinking about lately is how the mouth opens to nurse. So if this is a breast and this is a mouth, this is what the baby has to do to nurse. Wide open mouth. If they're on a bottle, they're like this. Just the tip of the nipple has to, they have to just get the nipple in their mouth. So that opening of the mouth forms the whole oral facial complex and forms the muscles of the face, head, and neck, and the oral cavity and the nasal cavity. The upper part of the mouth, or the palate, sometimes is a little elevated when a baby is born, but the breast against it actually, and the actions of it, bring the palate down. So for those of us who understand what that means for airway, the bottom of the palate, the bottom of the nasal cavity is the top of the mouth. So if the top of the mouth is high, you're going to have a narrow nasal cavity and have more difficulty with breathing. So, and this all works in a 3-dimensional view, right? So it's sometimes hard to imagine that what goes on in the front of the mouth affects the whole airway, right? The
Yes.
top of the airway.
So glad you
To me,
started.
that's the most important thing about breastfeeding,
Wow.
really. And
Yes.
we can't replicate that with pumping and bottle feeding, not to make anybody feel guilty.
Yeah.
And I always like to say, I didn't get this all right either, right? So I'm not doing my work because I'm preaching because I did it all right. It's the opposite. I do this work because I didn't have the help to do what I feel is best for an infant, an infant development.
I'm
So,
so glad you started with that because that absolutely connects so many dots between newborn related issues and breastfeeding versus bottle feeding and just ability to feed well.
right.
And then the development of the mouth too. I remember when my daughter was a newborn and I was going through all of these concepts as well, and she really didn't have a hard time latching on, and we didn't have a hard time breastfeeding, but thankfully we had a lactation consultant to help us with all of that, make sure we were doing well. But all that being said, I was then, of course, working. So then I would pump and, the bottle part of the times go back and forth. And then we were a big pacifier family. And I realized looking back now that there were, some mistakes that I made, no doubt about it, even though I was buying the latest, greatest nipple because it was supposed to make breast and all of that.
And you know what's interesting about that? Most of the nipples that are out there stating that they're orthodontic or the orthodontic pacifiers, they're the worst. They're the worst. So the more a bottle or a nipple on a bottle looks like a breast, the less helpful it's going to be. But you know what? We're talking really about ideal. There are very few women who don't ever have to give a bottle, right? And that shouldn't be our standard, right? We want to be realistic. Almost everybody has to give a bottle at some point.
Yeah.
But if you have in the back of your mind, the priority is the breastfeeding, and also realizing that even if you're not going to breastfeed, understanding that the reason the baby's having difficulty is something to look into.
Yes.
Right? You want to say, if my baby can't breastfeed, why can't my baby breastfeed? Again, we start at root cause even from the very beginning. Is it a milk supply problem? Is it the way I'm holding the baby? I've met so many women who've never seen anybody else breastfeed. They're the first in their families. That's who I was. I had no idea. And I was a nurse, and I didn't know how to hold my baby to nurse because nobody ever showed me, right? And we didn't learn it in school. We learned the basics in school, but we didn't learn how to position a baby at the breast. So, the point of all of that is there are many causes or there are many things that could interfere with successful breastfeeding, and we should investigate them, because part of what can interfere with successful breastfeeding is difficulty with that suck, swallow, breathe reflex that infants and newborns have. Their desire to feed is innate. It's a survival mechanism. And if that's not working, we have to say, what's going on there? Is there, maybe it's as simple as their noses are too stuffy, or maybe it's as simple as, not simple, but maybe they were born into an awkward position and they have some torticollis or a favoring of one side or the other. And when mom tries to hold them in a certain position, they can't turn their heads to the other position. You ever try to drive when you have a stiff neck? Like it's, you can't do it. So there are lots of things. Tongue tie, lip tie come into play often, but that's not the only thing. Even though I use the moniker tongue tie experts, I always want to let everyone understand that my goal isn't to have every baby's, have a surgery in their mouth. My goal is to make sure that we are not missing those babies who may have a tongue tie or a lip tie, and we're treating them appropriately and holistically to make sure that everything else is taken care of before and after the procedure. So I know a lot of people in your audience probably are a little bit above the age of childbearing and breastfeeding, but they may have grandchildren, like me, and I've been through a journey with my own grandson, or know people, or hear of things and say, well, whatever. But I did say, like, find out if you were breastfed, because I know that explains a lot for me when I remember my mom used to tell me that I even had reflux on the bottle. She didn't try to nurse me, and I was off formula at 3 months old. I was having whole milk, and that kind of explains my lactose and my milk protein allergy at this point in my life, and my, you know, fat cells that I have because cow's milk is made to make cows grow big, and so it's important to understand your history, starting with breastfeeding.
That is so good. So good.
Yeah.
Yes, all of the grandmothers and mothers, whether childbearing age or older, and fathers and aunts and uncles and those who know children. This
Mm-hmm.
information is relevant because we always think of, or I used to think of course, the number one goal, and that's true, is nourishment for the baby. Absolutely.
Mm-hmm.
They have to get the nourishment, obviously, to develop and grow appropriately. But there are these other critical related issues that if we can make everyone more aware of, they can understand that, okay, maybe they're growing and developing and they're getting their nourishment, but if they do have sleep issues, if they still have trouble feeding, or if as they get older, they do have ADHD, or they're, as you said, an open mouth posture and mouth breathing and not nasal breather. Those are telltale signs that need to be evaluated for sure.
Yeah. And you know what's fascinating? Newborns are very pliable. It's easy to correct things. The sooner we start helping a baby, the easier things are to change. So there are just simple exercises you can do to get your baby to have tongue on the roof of the mouth while they're asleep and having their mouth closed that aren't disturbing to them. Please, nobody tape a newborn's mouth. There have been some social media things about taping babies. We do not tape a baby ever. But there are gentle exercises you can do, and positioning while the baby's asleep. And, and I'm going to say something that sometimes it's a little bit controversial, but, we've had in the past, I don't know, maybe 20 years now, this back to sleep campaign. I don't know if it's as strong all over the country, but in New York especially, we have a very strong back to sleep campaign, meaning that babies are placed only on their back to sleep. And this has had some repercussions because back sleeping isn't the natural method or the natural position that a baby would sleep in if there wasn't this rule. So we've seen some repercussions from it. One is that the head gets flattened, right? So if we think about how much time a baby spends on their back, we want to make sure they're spending equal times off their back so that their head shape isn't affected that way. And unfortunately, a lot of pediatricians won't intervene or don't know what to suggest about that because they have to follow the rules. They don't know what to tell the parents until it's too late and the baby needs a helmet to form their head. So you may have seen babies being, brought around and they have helmets on their heads. They're not going motorcycle riding. They're trying to reform their skulls. So the skull is very pliable. Everything in the baby's head is very movable, especially before a year old. So we want to make sure that they're not always on their backs. So wearing a baby in a carrier, letting them, holding them, we're not going to spoil a newborn. We want to hold them upright as much as possible, skin to skin on your chest, laying back with them on your chest, and supervised tummy time. Not as something that's like it's time for tummy time, when letting them stay on the floor for 3 minutes on a mat, but letting them be on their bellies a lot for play and having toys around them. And also, I go as far to say, as a baby can have a supervised sleep, a supervised nap in your living area on a flat surface in a bassinet on their belly, as long as they're not constrained, no swaddling and putting them on their belly, which I've seen, and no fluffy pillows or blankets around their heads, and just on a flat surface, and you're checking on them, and most babies will sleep better that way, or side lying if you're not comfortable on the belly, but just to make sure that the baby's head is forming in the way it's supposed to, not restricted by something flat against the back of the occiput. And then, because the reason for this is it all ties into what I was saying about the three-dimensional airway.
Mm.
Everything comes in a different shape. You know, you can see those like triangle shaped faces, and then where's everything going with the airway? It's all pushed back and there's no place for the air to pass. So that's my spiel on back to sleep. Do you have back to sleep? Have you heard that term, or is
Yeah.
that just, yeah,
Yeah,
okay.
it's
Yeah.
big in Texas as well.